So TROPHY trial was a phase 2 trial which investigated an antibody-drug conjugate, so Sacituzumab govitecan, which target TROP2, and TROP2 is expressed in nearly all urothelial carcinoma in around 80 to 9%. And there is a payload. The payload is the SN38, so the active metabolite of irinotecan. And SG was investigated in patients with metastatic urothelial carcinoma, previously treated with chemotherapy and PD-1 or PD-L1 inhibitor. So we were on third line or fourth line, fifth line. 113 patients were treated in this cohort 1, and the primary overall response. And what we find, the overall response rate was 27%. It is very important to stress that the lower boundary of the confidence interval was 19%. So that the overall response we can expect from single agent chemotherapy in this setting with paclitaxel, vinfrinin, we can expect an overall response rate of 10–15%. So it's a positive trial. There is activity, and regarding the safety, there were some side effects. Diarrhea, for example, which was observed in 2/3 of the patients. Diarrhea was mainly grade 1 and grade 2 and easily managed with dose reduction, dose delay, for example. Another side effect was the neutropenia. We found 10% of febrile neutropenia, while 30% of the patients were treated with GC. So it's something we have to look at, and we have to educate and to manage this patient very, very carefully. So overall, the data show that SG has a good safety profile in this heavily pretreated population of patients with metastatic urothelial carcinoma, and there is activity. So a phase 2 trial will start in the coming weeks, and this phase 2 trial compare SG to chemotherapy, so vinfrinin, docetaxel, paclitaxel, in patients previously treated with platinum-based chemotherapy. I think the data are good because, once again, it's better than what we can expect from the conventional chemotherapy. So it seems it's better. So maybe SG could be approved by FDA based on this data. In Europe, it could be obviously different because we need phase 2 trial, but the median PFS in both the TROPHY trial was 5.4 months, which is quite good, and the median overall survival was around 10 months. So there is some comparison between SG and enfortumab vedotin, which is already approved in US. So in the phase 1 and in phase 2 trial with enfortumab vedotin in the exactly same population of patients, the overall response rate was 40%, so a little bit higher, but the median PFS was around between 5 and 6 months, so it's quite similar. And the median overall survival was around 10–11 months. So overall, I think it's quite similar. Maybe the response rate is a little bit lower with SG, but the safety profile is different between EV and SG. So it is important to note that I think that patient could be treated with both EV and SG. And important enough, in the TROPHY trial, 10 patients were previously treated with EV before the trial. And what we found is that 3 out of 10 patients respond to SG. And 2 of these 3 patients had progressive disease as best response. So this data suggests that there is probably not cross-resistance SG and EV. So overall, I think it's an important drug that we have to now to push in a phase 3 trial, and maybe in the SG on top of EV in clinical practice.